One of the things that concerns prospective patients the most about having cosmetic surgery is the type of anesthetic they will have. And the concerns range from one end of the spectrum to the other. Now, for very simple things, such as removing a small mole or something like that from the face, then we can use what we call local anesthesia, the same type of anesthesia that you get injected when you're at the dentist's office. And indeed, for the patient who seems to be a little bit more brave than most, we can sometimes do a little larger procedures like removing excess upper eyelid skin or even performing an otoplasty, for example, under local anesthesia. However, most patients, as we utilize a procedure that may take, let's say, an hour or so or longer, they'll feel that they'd like to be a little bit more relaxed and perhaps don't want to know so much as what's going on. In those patients, we may use local intravenous sedation anesthesia. What we do here is place an intravenous line, and we give you some medication in the intravenous line that makes you relaxed. And I might also add, it also makes you forget some of the things that are happening, so you don't remember the bit of pain with the injection, for example. Also, some analgesic drugs are used at the same time, so that when we are injecting or doing our work, that you don't feel it as much or feel it at all. And so local intravenous sedation anesthesia can be very, very effective for many of the procedures that we do. There may be some other procedures though, for example, the longer or more detailed facelifts, where we really do feel that a general anesthetic is going to be best. This is because you're going to be right asleep. You really won't remember anything. It's just like going to sleep and waking up, and the job is all done for you. One of the problems that can occur, because people think, oh well, local anesthesia is always safer than general, is that for longer procedures under local intravenous sedation, if you get a little bit agitated, then more sedation is required. As more sedation is required, you may not breathe as well and get more agitated. So the point is that in some cases, general anesthesia is much better than local intravenous sedation. We'll certainly have that discussion with you. And you should also know that with the anesthetic agents we have today, you are very, very safe. You are literally 5 or 10 times more likely to have a serious event with a car accident than you are having anesthetic surgery. But you drive in a car frequently, and so you don't perceive that risk as being very high. You don't have anesthetic very often. You perceive it as being higher. So today, I can assure you we have excellent anesthetic drugs. We have excellent anesthesiologists. We monitor you very, very closely, and we'll help you select the best anesthetic for you for the procedures that you're going to have.